Uganda Aids Commission has underscored the importance of heightened sensitization of masses about the HIV/AIDS scourge. Despite Uganda registering major strides to national prevalence of 5.8%, there are reports that point at low levels of treatment literacy, in addition to stigma suffered by persons living with HIV as bottlenecks to access to medication.
You cannot expect a young person living with HIV to come out and live when they actually expect to be discriminated against, to be isolated in the communities that they thrive in. Secondly, we could also look at the low levels of treatment literacy. When Doctor mentioned about adherence, there is no adherence if you cannot understand the kind of medication that you're on. And if you're not taking the medication, obviously you will succumb.
And that's the reason we come to you and we come to bring this message to Ugandans. That unless we take it upon ourselves and recognize that the threat of new infections, the science is there, we know how to protect ourselves. You need to know your HIV status, but if you do not take the leadership to know your status, to protect yourselves, new infections are still there. That's why we are having 1,000 new infections every week, and they are affecting predominantly young people. But the way to dispel them is to ensure that we are armed with information and we're also addressing the structural drivers.
This year's World AIDS Day will be marked on the theme, Let Communities Lead. The Executive Director, Uganda Aids Commission, Dr. Musoba, says both the global and national themes hint at having collaborative efforts in the fight.
Because the services can be there, the health workers will be waiting, the drugs will be there, but unless as an individual you take the initiative, you test, you know your status, you get the counseling, you seek to protect those around you, If you know you're in a discordant relationship, you take responsibility to know that you protect your partner. That is leadership. That's what we are speaking about.
UNAIDS Country Director Jacqueline Makoha calls for an enabling environment for civil society organizations and development partners to realize an end to AIDS.
Community leadership roles need to be fully and reliably funded to enable the required scale-up and to be properly supported and remunerated. Not ending AIDS is more expensive than ending it. Barriers to community leadership roles need to be removed. An enabling regulatory environment is needed, which facilitates communities' role in provision of HIV services, ensures civil society have space, and protects the human rights of all, including those of marginalized communities, to enable the global HIV response.
Available statistics show that Uganda has about 1.4 million people living with HIV and AIDS, and a worrying trend of about 17,000 deaths annually.
I have told you that 1,000 are getting infected every day. So the statistics are fluid. They got guidance, but really Ugandans, we can stop this disease if we did these things. Stop the infections and stop the deaths. Then the few of us who are already infected, you will combine forces to make sure that we don't die of this disease. Meanwhile, we are not infecting you. So we don't even need laws about this. We would really be home and dry.
Dorcas Kimono, UBC News.